Well, could that pain in your knees or hip affect how you interact with others? Well, a new survey says yes, indeed. Here with more is orthopedic surgeon Dr. Sarkis Bidikian and patient Barb Crawford. Good morning to you both.
Good morning.
Good morning.
Great to talk to you guys from Chicago this morning. Let's start with the pain itself. Doctor, what are some of the most common causes of pain?
Well, the most common cause is osteoarthritis. It's a degenerative process that affects over 30 million Americans. It causes pain, stiffness, and it gradually gets worse as we go on. Pretty much is a wear and tear of our joints.
And you have Barb there with you. Barb, we're going to ask you about your experience in just a moment. Doctor, women in particular can experience osteoarthritis and chronic joint pain. What are some of the pain issues that seem to be common in women?
Well, some of the common joint pain related issues are those that affect one's activities of daily living. So simple activities and tasks like going up and down stairs, gardening, shopping, church, those types of things. The survey and women in the survey talked about how it's physically limiting themselves from doing these activities and how much of an emotional strain it puts on them to be able to accomplish these simple tasks and how it affects them on a day-to-day basis and affects their relationships with their loved ones.
Yeah, absolutely. I mean, when you're in pain all the time, it does tend to wear on your mood. I've experienced it. Barb, you have experienced knee pain. How did this impact you in your life?
Well, just like you're talking, very much the same thing. I was in my 50s and it was just a debilitating pain by then in both my knees. So my day consisted of what could I do based on what my knees could handle. And most of the time it was pretty depressing because I had to say no and not be involved in a lot of life's activities because of the knees I had. So my relationships with my family and friends all changed. It was all affected, not just the pain part, but emotionally it was too. I mean, even intimacy with my husband and then with my family, I was always setting out on activities. So then after a few times, I pretty much got excluded or was just absent from the activity. And my grandkids knew me as the grandma who could just sit and watch them.
Oh, no.
Not really be actively moving around. And I lost out even on babysitting because I couldn't keep up with them. So that kind of just started happening. And you just started feeling more and more isolated. I felt like I was losing my independence.
Yes.
Like maybe I'd pull into everyday shopping with my car and just realize I can't even handle making a few steps into the store.
So Barb, let me ask you.
I just got to turn around and go back home. I can't do it.
The picture you're painting is, well, it's quite frankly really depressing, but I noticed that you're telling the story in the past tense. Did you do something about it? Did you have some kind of turnaround with your pain?
I went and talked to an orthopedic surgeon, and we did everything that we could do in terms of therapy, exercise, shots, everything, and then just came down to the fact that surgery needed to happen and a double knee replacement, and that's what I did. That was the option that we chose, and it was all really about gaining quality of life back. It really wasn't about my age. It was just really about, not sitting on the sidelines any longer. And I did the surgery, the physical therapy, and really turned back time. I feel younger than I used to feel.
Oh, terrific. Well, congratulations. I'm so happy to hear that you were able to turn it around, Doctor.
Thank you.
Thank you both for joining us this morning.
Thank you very much for having me.
All right, you heard Barb. Don't let pain control you. To learn more, visit timetohitplay.com. DePuy Synthes is a proud sponsor of the Morning Blend. And don't